Good evening, everybody. Hopefully everyone's okay and they've had a fantastic week in life in lockdown. But Maud, how's your week been this week?
Hi everyone. It's been good. It's been busy in clinic, so it's good. It's always good.
Yeah, good. Good. So today, everyone on Facebook, we're going to be talking about wrist injuries. So wrist injuries are a really common presentation in clinic, and it's surprising how such a small joint can actually cause so many problems. But it's a really important joint, isn't it, Maud?
Yeah, we'll probably say it's one of the most important joint. We don't think about it often, but it's actually used in most of our life and our day-to-day life. You always use your hand and your wrist. So it's actually one of the most important joint to keep healthy.
Yeah, exactly. So I guess in your job it's really important, but there are lots of other people that use their wrists for their job as well. But there's a couple of interesting things to talk about with the wrists, and one is if you're watching live on Facebook, you may have heard of Maslow's hierarchy of needs. So Maslow's a psychologist, and Maslow talks about this hierarchy of needs. And at the top, you've got such things as self-actualization, which are pretty much impossible to get to, although everyone tries to, which is good. But right at the very bottom, you've got the basic needs. Now, one of the basic needs is food, and we were talking about it in our team meetings today. We had a bit of a laugh about some of the other basic needs in there, but some of one of the most important basic needs is being able to feed yourself. So the wrist is clearly really important to be able to function properly, to get food inside your mouth, which is one of the basic needs. So it's a really important joint in the body. But Maud, what kind of problems do you see people coming in with in clinic that could give them problems with their wrist joint?
Yeah, I'd say there's quite a few different things that they can come with. It's probably they can have trauma. So if they fell on their wrist and then they started to be painful, or they've been working a lot more at their desk or doing a lot more repetitive movement using their wrist, then they start getting some achiness around the wrist and sometimes some pain going into the hand in the fingers. So that's what we mainly see in clinic.
Yeah, so desk-based injuries are probably one of the most common presentations of wrist injuries. And the other common presentation, because of the type of clinic that we have, and we treat a lot of pregnant ladies, is something called the Quervains tendonitis. Now, that's a great one for Scrabble. I'm not sure if it fits on the board, but I'm sure you get a lot of points in there because there's a big Q in there as well. So how many points do you get for Qs in Scrabble? I think it's like a gazillion points, isn't it? It's a lot.
Yeah, I think it's, I'm not sure, don't quote me, maybe 10 or something, but I'm not sure.
I'm Google that afterwards, Scrabble Q. So if you know how many points you get for a Q in Scrabble, I'd love to know. Love you as well. But if you do know, I'd absolutely love you. But yeah, if you do know, we'd love to know how many points you get for Q in Scrabble. So that's the question of the day. But de Quervains tendonitis is a bit of a mouthful to say, but it's a really uncomfortable condition, isn't it? So how does someone come in that's got de Quervains tendonitis?
Yeah, so de Quervains tendonitis usually, so it arrives in the thumb. Okay, which way? Up. Around here. So it affects the tendon that goes up into your thumb. So basically, you're going to get pain every time you're moving your thumb and you're using one of the really common thing, it's texting. So that's a very common 10 points.
10 points, absolutely. Well done. Well done, Shannon, not just well done, Maud. Thank you very much, Shannon. It's brilliant help.
Good. So yeah, so it often comes when you're texting because you're using a lot of opening and closing the thumb down, which is going to make you use the muscle of the forearm and that tendon a lot more, which then can inflame a little bit and irritate that tendon and create some sharp pain when you're moving your thumb.
It's a really painful condition. When we see people in clinic, one of the common things that we do straight away is grab the ultrasound and put the ultrasound on there. And actually, we can have a look inside the tendon and inside the wrist, and we can see the tendon. And there's this very thin fluid level, so a little bit of fluid around the tendon, inside the tendon sheath. And the problem with that is that the tendon slides in and out of this tendon sheath like this. And if this tendon sheath has too much inflammation in it, then what can happen is it becomes quite irritated, the tendon. It becomes quite painful. So it gives you a lot of pain in the base of the thumb, and that really causes a lot of problems. So Shannon was saying that she's got tendonitis in her right lower arm, and it's got pins and needles down my thumb when I type too much. Does that apply? So, Maud, I'll let you take that one.
Yeah, it could apply when she types too much, and it can also be more what we talked actually last week when you're looking at epicondylitis and problems up in the forearm of the muscles, then coming down into your hand, and those muscles can sometimes irritate or irritate a little bit the nerve as it passes through, and then create some pins and needles in the hand. So it could come from the forearm, so really tender muscles up the forearm, or due to this tendon inflammation down into her thumb.
Absolutely. There's a couple of small branches of the radial nerve that come down the back of the thumb down here, and they run along those tendons or very close to them before they branch out into the rest of the hand in here, just like Maud was saying. So often it can just be because of the amount of inflammation in the thumb as well, and also the restriction might not be in this part of the wrist, it might actually be up in the extensor muscles in here. So that's quite a common presentation, that people start to get pain in the elbow around here as well, which is where the radial nerve comes down, and then you get all sorts of funny things happening down in the back of the wrist. It tends to be this side of the wrist, not this side of the wrist, that you get affected. So that's really important to remember. But Shannon, you need to get yourself booked in, see yourself a proper therapist. But yeah, if you want some advice or help, just get yourself booked in, and we're more than happy to have a chat with you on Zoom and see what we can do to help you. Maud would be more than happy to have a little chat with you and see what we can do. Maud, is there anything else you can give advice to people about with regards to that condition? So if they've got tendonitis in their base of their thumb, what else would you advise them to do in clinic that's sensible, that's easy to do?
Easy to do. I'd say probably if it's really inflamed, you're coming very acute in a lot of pain. First thing would probably to put some ice on to try and decrease this inflammation. It's going to help with the pain as well. So starting with that, and then at the beginning is going to be decreasing at least that activity that brings on the pain. So it's going to be decreasing, doing a lot of typing, a lot of texting and things like that, to try to not further irritate that tendon sheet and that tendon, and try to give it a little bit of a break. And so you can use sometime braces or things like that. But then the third thing would probably be to go see someone that can help you with the muscle irritation or the muscle hypercontractors, so the muscle tension that we can then release and help you with that long term.
Yeah, exactly. And I think one of the things that I love about clinic is it's some really easy stuff that you can give people advice on. You mentioned ice there. Another thing you might want to give people advice on, if they're okay with anti-inflammatories, is actually to use some ibuprofen anti-inflammatory gel over the tendon sheath here, which can be very effective. Just a pea-sized drop there. It's quite easy to do. You can pop it on there. If you've got a sensitivity to anti-inflammatories, you need to go and see someone as well. And even if you don't, it's probably a good idea to make sure that you're safe to take it, because it can have similar effects as taking oral anti-inflammatories as well. But because you're only going to be doing it for a very short time, because it's either going to work or it's not going to work, that's going to be normally okay to do. But it's something the pharmacist or the GP can advise you on if you're desperate for some help. But ice is something easy you can do, which will 9 times out of 10 start to calm down the inflammation. For me, the number one thing to do is to try and avoid the angles that are causing the problem. Now, if those of you at home, there's a couple of simple tests to work out if you've got this condition. So Shannon, if you want to follow on board with this simple test, I want you to take your hand up in front of you, and if you bring your thumb across the forefinger, well, it's giving me cramp already. Let me do this. It's a long day in the office. So bring your thumb across there. Now I want you to close it in your wrist like that, and I want you to just gently bend your wrist so that it goes away from where your thumb is. Now, if that turns out to be painful, and it's specifically painful here, like excruciating pain, that's called Finkelstein's test. So Finkelstein's test is very useful for picking up the Quervains tendonitis, and it can be a real lifesaver, because if you think you've got tennis elbow and you do that test, it shouldn't be positive if you've got tennis elbow, but it definitely will be positive if it's just the base of the thumb that's affected, and we need to deal with that, not the tennis elbow, or we need to deal with that first, and then we deal with the elbow pain later, because it's a priority to get that sorted out sooner rather than later, because if you've got the pain here, it's going to make the muscles tight up in the forearm up there as well. So just thinking about it logically there, but yeah, deal with the pain first and get that immobilized and get it working better. But yeah, is there any other advice you'd give to people with that particular condition? There's so many things that can go wrong with the wrist and hand, aren't there?
Yeah, I'd probably say because pain in this area can be something a bit different. So if we can talk about that just now, you need to make sure that it is coming after repetitive movement and not after a fall, for example. Because if you get pain in this area and you've fallen onto your hand, it might be something completely different than looking more about a fracture of the scaphoid, which is a bone that's right in here. So it's just next to where the Quervains pain is. So you just need to be careful to not mistake both, and to get that checked out as soon as possible, because you need to get it checked out if it is a fracture of the base of the thumb.
Yeah. So do you know the test to work out?
It's to press right in there, isn't it?
Yeah. So there's if you look at my thumb, I've probably got quite good ones because I'm quite bony. But if you look there, and you look really carefully, if you guys do this at home, if you put your thumb up in the air like that, what you'll notice when you cock your wrist back is that there's a very small indentation that forms just in the inside of your thumb. You can see mine because I'm quite bony. So, oh, I can't get this camera right. It's mirrored. Here we go, there. So just inside here. Now, that's called the anatomical snuff box. So the anatomical snuff box is where it's said that people used to, in days gone by, and the grown-ups, they used to put substances, let's just call them, inside here and sniff it off there, because it's an anatomical snuff box. Snuff, I think that's what it's called. But that's quite an important anatomical site, because inside the anatomical snuff box, so if you take your finger and you press 45 degrees into the snuff box, that's pressing right on the bone called the scaphoid bone, and that's probably the most commonly damaged bone inside the wrist and hand that's missed. So the other ones can be easily picked up, but that one causes a lot of problems. And we see quite a lot of people with that problem, but often when it's too late to do anything about it. Now, the reason why that particular area is important, Maud, I'm sure you remember, do you?
Yeah, so it's sometimes if there is a break in that bone, it can cut off the blood supply into part of the bone, and then this bone without blood supply will start to die, so necrosis, so start dying a little bit, and that can be quite dangerous. So you want to get that checked as soon as possible if there is that happening during the fracture.
Yeah, absolutely. There's something really interesting that happens with the scaphoid, is that the blood supply, instead of coming up from here and going to the base of the thumb to the scaphoid, it goes up past the scaphoid and then comes back onto the scaphoid. So what generally happens is that where the scaphoid is, so if that's the scaphoid bone and the blood supply is coming down onto it rather than up onto it, what happens is the recurrent branch here, if you get a fracture across it, this bit here, which is closer to your wrist, that starts to die, and that's the bit that you press on, and it becomes a problem. Now, the reason it's a problem is because if that dies, it becomes arthritic inside there very quickly, and it can cause lots of impingement and pain when you try and move your wrist, which is a real big problem if you've fallen on your wrist later. So that is often when we see people with scaphoid injuries. It's when they become arthritic and they got missed earlier on. Have you seen a lot of arthritic thumbs?
Yeah, quite a lot. And you can really feel it. They know it directly. You get pain at the base of the thumb, and then you get stiff when they start doing a lot of exercise or using it too much. And you can feel it. Then you start moving the thumb, and you can feel some restriction into the thumb movement.
Yeah, it's really painful. And I've seen lots of people with very arthritic thumbs. They tend to be the older generation, but one of the problems they get is that they find it very difficult to move their thumb. Now, there's a very interesting thing that separates humans from other mammals, need to get that right, is that we can do this, which most other mammals can't do that. That's called opposition. So the reason why that's important is because it allows us to use and manipulate tools. So not only can we climb like that, like other mammals, we can also manipulate tools because we've got that dexterity. And because the thumb comes across the hand, that's super important because it allows us to close our hand and be able to grasp things, especially small things of fine detail and like pens. And I'm not saying you write with your little finger, but being able to like hold your pen. I get, if anyone ever sees me writing, could you tell me to write properly? Because apparently I write like an ape. Like
Yeah,
how do you hold your pen? Yeah, not quite that bad. That's pretty bad. How do you write?
Like that.
Like a European, continental.
Sometimes maybe two, but usually one, I think.
Let me find a pen.
You're just holding it like that with all of your fingers.
Pretty much hold it like that and write.
Like
I hold my pen like this, and I get criticised all the time for holding my pen because
Why?
That's not bad, is it?
I think that's high.
I don't think it's too bad. I think it's sometimes when I'm really concentrating, it does go into like ape grip. So hold the like this, sort of right like this. But yeah, it does become a bit simian. That's not such a good thing, by the way. But yeah, I think it's really important. So not only going to lose the function of your hand if you get this arthritis there, but also it becomes quite debilitating. A very painful condition. I've seen grown men cry with arthritic thumbs, and there's not a lot you can do about it unless you come to perfect balance. So one of the things that we do with arthritic thumbs is give you lots of naturopathic advice. So naturopathic advice for arthritis would be to reduce inflammation. It would be to look at things that help supplement the joint health. Look at things like hydrotherapy. That's really important. Working on the muscles that are above the joint, because that's really important. So often an area that's forgotten is actually just releasing the tendons here to make the thumb not be so compressed because of the forces coming through there. That can make a huge difference with the arthritis. We use things like laser. So we have a high-powered laser. Well, diagnosis first, but then laser is quite useful for arthritis in the thumb. And we get some very good results with people with hand arthritis in particular, with those kind of conditions as well. If that fails, and we've got some good orthopedic surgeons that we work with who may do joint injections or slightly resect the joint so that you've not got the bone on bone there, and they fill it with softer tissue or stimulate scar tissue by doing sclerosing injections in there to stimulate the scar tissue formation. So that might be things that might be useful if you've got kind of thumb arthritis or joint arthritis in the hand, but it can be very disabling, can't it? Yeah. So are there any other fascinating facts about the magic moments, let's call them Maud's magic moments? What are the Maud's magic moments can you have with regards to the hand and wrist?
I think a very common condition as well is carpal tunnel syndrome.
Yeah, that's probably the biggest one.
Yeah, we see that a lot in clinic. So basically, that's usually patient present with some kind of pins and needles or numbness, usually in those three fingers, so the thumb and then the two fingers, and then sometimes a bit of pain in the wrist. So that's irritation of the median nerve that passes through the front of your wrist here. And it passes just behind what we call a flexor retinaculum, which is just a band of tissue across. And then you have lots of tendons and nerves passing through under here. And what can happen is that the space can become a little bit smaller and so start to irritate onto that nerve, the median nerve, and then creating those pins and needles and numbness into the top of the fingers, the three fingers.
Yeah, it's a pretty. When we look at it with ultrasound, it's a really interesting place because you've got 9 tendons that run through that region, and there's only 4 fingers and 1 thumb.
Yeah.
So isn't that interesting? Because you've got so much going through there, and you've got basically those 4 fingers have 2 tendons each that run into that part. So they're all coming through here. So you've got a lot of tendons coming through here. The thumb this way, the thumb has one of them. That comes through here, and then most of the others for the thumb are outside the carpal tunnel. But yeah, it's a fascinating area, and it gets so tight in there, and the poor little median nerve that comes through that area can get squashed. So it's like a hose pipe becoming squashed, and the information coming from your brain doesn't get to the hand, and the hand information from the skin doesn't get back up to your brain. So you get this sensation of pins and needles or numbness, as people might refer to it, if it gets very severe as well. So are there any things that we can do for people with carpal tunnel?
Yeah, I think you can do quite a lot. So we would look at opening up the wrist. So what we do is a really nice technique actually, that you just kind of open up the space through the wrist and then try to release the soft tissue through there.
Yeah.
And we can also look at all of the bones through your hands. So trying to work within the mobility of your wrist, in case if there's a little area that's a bit stiff, that might push onto that area at the front of your wrist. So we're trying to release any tension through the bones. There's lots of little bones along here. So there's
8.
There's eight little bones across there.
Yeah. Do you know the rhyme about Sally?
I have another one, I think.
Is it clean for Facebook?
No.
Just miss out the naughty words and we'll try and guess the naughty words.
I can't remember exactly. It's some lovers.
Yeah, that's the one.
Do you know that one? Yeah. You say it.
No, I think you can say it.
Come on, some lovers.
Try
Different. No, it's not different.
So positions. So some lovers try positions that they can't handle.
That's it.
So that's how when we're at osteopathic school, that's how we remember the 8 carpal bones there. So some lovers, so some scaphoid, lunate, trapezium, pisiform, try positions. That's trapezium.
Trapezoid.
Yeah, trapezium that they can't capitate, and hamate. Yeah. Some lovers try positions that they can't handle. Yeah, interesting. But yeah, it's there are some ruder ones than that. So that's pretty tame. We kept it tame for Facebook, but yeah, there's much ruder ones.
Well, you kept it clean.
Yeah, exactly. It's funny how you remember the rude stuff, though, isn't it? It's like maybe it's just me, but it's quite easy to remember the rude stuff. Like stuff your mum and dad wouldn't want you to repeat at home, but yeah, it's quite insane. Sorry?
Sticks in your brain.
Yeah, exactly. It does stick there. It's funny that. But yeah, that's pretty much the hand and wrist. So there's loads that goes on in the hand and wrist. But yeah, if you get problems there, we can certainly give it a good look and see what we can do to help. But yeah, it's can be quite disabling to have hand and wrist problems. So the sooner you get it looked at and the more thoroughly it's looked at and the better diagnosis is, you'll be able to get moving forwards and feel comfortable when you're having your evening meal and you're chopping up or you're writing your essays for school or you're tapping on your keyboard or doing your texting in the evening on Facebook and giving us lots of love and hitting that like button on Facebook.
Yeah, and I think with carpal tunnel, it's a lot of people at desks and with that typing and that using mouse and things like that, constantly putting some pressure through the front of their wrist. Yeah. So it's thinking of having a good posture at work and with the desk and everything that's going to help with the tension through the wrist and the forearm.
Yeah, definitely. That's all really important. So it's just about optimizing the biomechanics. So especially like when you're lifting your kids up, it's very easy to lift kids up, especially when they're small, and just cock your wrist back like this. And that's often what causes a lot of the strain in the wrist area here when you're lifting and you're doing the wrist movements as well. So when you are lifting, just try and lock that wrist joint so it's nice and stable and lift with stable wrists. And often women that have had babies are less aware. They're kind of in a rush trying to get the babies dressed and get all this stuff going and lift their stuff on, but they're much more mobile in that period with their wrists and hands. Obviously, they're very careful with their babies and their belongings, but it becomes quite difficult to remember to keep that wrist locked. And the ligaments are a bit more lax because of the hormones are relaxing because of the oxytocin and everything that's going on from the breastfeeding. So that can put a lot of strain on the ligaments, which then overuse the tendons and the muscles around the wrist joint. So you're really quite prone to that condition. So you've got to be quite careful with that during that later stage of pregnancy when you've got the weight there and you're lifting repetitively and not thinking so much about it.
And there's also at the end of pregnancy, they're quite prone to carpal tunnel due to the slight swelling that they might get. And then with swelling, it just decreases the space through this front of the wrist that can create a bit of irritation as well on the median nerve.
Exactly. It's because you're tired, you're worn out by your kids and you're flicking through Facebook like this That's going to give you a lot of wrist problems. You're doing this on the Instagram feed. That's definitely going to give you wrist problems. That's a very interesting point, because I had someone that unfortunately he lost his job. So what do you do when you lose your job? You go on Instagram, don't you? And you're like this all day long. Not that I know, but I've been told if you lose your job, you end up on Facebook and Instagram, going through this, scrolling through stuff. And actually, I think they were buying a house or something, and they were looking at furniture, and he's spending all day long. I think if he listens to this, he'll know exactly who he is. So I won't say what his name is, but he knows he's got to cut down his Instagram use, and he definitely shouldn't be on Facebook watching us right now. At least he's not scrolling, so it's good. He's probably watching us. That's good. But yeah, you just got to be really careful on social media, because the time that you're on there, you can get quite distracted, and time goes by, and you're literally doing a very repetitive motion. And all joking aside, it is a very repetitive motion, whether you're texting, using your thumb to, scrolling through the feed there. So that's a very unnatural movement for the thumb. So it can cause a lot of irritation there. So you've got to be careful with that. Any advice for people on Facebook and Instagram that would find it challenging using the using the phone differently? What would you say to them?
I'd probably try to stop. So or you use more of the computer to have your hands a bit more kind of at rest like this, or kind of not for an hour, don't do one thumb. Try and swap the other, or try and place your phone, for example, somewhere in front of you, and then you can just kind of rest your arm maybe, and then use your fingers and things like that. Well, anything for a long period of time is going to be a bit irritating. So it's about doing breaks and not doing it for too long.
Excellent. Have you seen those things that stick on the back of the phone? So you actually hold it like this. They're actually really good, because when you've got the phone open and you're using it, you're not kind of gripping the phone, which makes a big difference with how you hold it. So
like this, holding on. So
yeah, exactly. Yeah, so you can quite easily use one hand. You can change over, use the other hand as well. I think when you're kind of in bed and you're scrolling through, it's a bit more difficult. So you might need to change sides. And also, I've been told I wouldn't use my phone in bed because it's very bad for you, of course. But everyone's been caught out doing that, haven't they?
Of course. Never do. I'm never doing that.
You never do. You never do it, do you? Maud's magic moments definitely doesn't do it. Excellent. Listen, it's been great talking to you, Maud, but we've got to go. But what would be your top 3 tips for anyone struggling with wrist and hand pain right now?
Try to watch out for those repetitive movements. So which should be at work or on the phone scrolling or anything during your day-to-day life. Try to be careful on this continuous repetition of movement. Definitely try and get in touch with someone that can help you around your area, or give us a call or a comment around here if you need anything. But I think that we can really do a lot and try to diagnose exactly where the problem comes from. And then from there, as soon as you know that, you can have kind of a planning and then a plan to try and get you better as soon as possible. There's a lot of things that can be done. So you're not alone in your pain at home. There's a lot of things that you can change and that you can do to get yourself better.
Yeah, good.
Yeah, I think that's it.
That's pretty much it. And remember that test, Finkelstein's. Do this. It hurts it. Go and see someone about it. Really useful test. It will save you a lot of time and worry trying to work out what's going on there. But yeah, great. Thank you very much, Maud. It's been great talking to you as always. And you're going to be doing another one, aren't you, with Sophie? Sophie,
yeah. Yeah, we haven't planned any what it's gonna be about yet, but we'll let you know as soon as we know.
Maud is taking over Facebook. Love it. Excellent. Good. Well, listen, it's been great talking to you, and hopefully you have a great weekend. And for you guys on Facebook, if you'd like any information about what you can do with your hand or wrist injuries, just leave your details in the box below, or comment me in the box below. Capital M, capital E in the box below. And we're more than happy to cycle back and answer any questions you might have, or come and help you out with a little sneaky online Zoom consultation if you're remote from us. But we're more than happy to help you out in all seriousness. And it's a really important joint to keep well and keep healthy. So please look after your wrists and hands. But for now, I'll use my wrists and hands to say goodbye to you.
Bye.
And goodbye to Maud over here.
Oh.
See you later.
Bye.
High five. Should we try and do the high five?
Wait, which? Yeah.
Excellent. Good stuff. Have a nice weekend, Maud. Take care.
You
Bye-bye.
too.